So, moving on, our next speaker for today is Tyler Pirie, who will be presenting a spotlight on health human resources, data modernization, and advancements. Tyler Pirie leads the Special Projects Data Development Team within the Health Workforce Information Branch at HIE. He has a master's in epidemiology and biostatistics, has presented at national and international conferences, and is a former Ontario Hospital Board Director. Currently, Tyler and his team are working to advance the collection and reporting of health workforce data in Canada. He will be presenting his latest findings on health workforce vacancies at the upcoming Canadian Association of Health and Social Policy Research Conference in Ottawa next week. So over to you, Tyler, for your presentation on Spotlight on Health Human Resources.
Thanks so much, Linda. And it's great to see so many participants online. I had to put a plug in there for my upcoming conference, just in case there's other folks on the line who are attending. Please drop by and see me if what I'm talking about today interests you, and I can certainly elaborate on that. So I'll go ahead and try giving my screen a share here. Okay, so thank you for the introduction, Linda. I would say that my presentation today is going to be a little bit more high level. I know it's probably around supper time on your end as well. And so maybe it'll be a bit less technical, more high level. It's really intended to give you an overview of the health workforce information that we collect at HIE and some of the advancements we're making to the overall data collection and reporting for the country, essentially. So I want to give a quick overview of the session, some of the things I'll be going over today. First, I want to start off with just kind of a high-level overview of what is the health workforce. So when we talk about the health workforce, who are they? What is their role? Why are they so important? Why are we spending 45 minutes talking about them this evening? And then I want to talk about some of the health workforce data and products that we produce at HIE. So with all the data that we have, what do we do with it? And then what I really wanted to focus on and what I'm most excited to talk to you all about today is some of the spotlight projects and initiatives we have underway. So I've only picked a handful. We have a lot going on at HIE with regards to health workforce information, but I've chosen a few that I think most of you will be interested in seeing and hearing about. And then I think I was planning to do a product demonstration of some of these initiatives at the end, but I may try to build it in if my screen share is working properly. And then of course, I'll give some closing remarks and open it up to some questions. So who is the health workforce and why are they so important? Well, when we talk about the health workforce, we know that there's many different types of providers in Canada. And when most people think of the health workforce, they think immediately of doctors or nurses, paramedics perhaps. In reality, of course, it extends much more broadly than this. So we can have dentists, dental hygienists, chiropractors, audiologists, optometrists, ophthalmologists, personal support workers, social workers, pharmacists, the list goes on and on. And we know that the health workforce is, of course, one of the greatest assets of Canada's healthcare system. It's the backbone of the healthcare system, really. And so it's vital that we collect data to inform evidence-based planning around the supply and distribution of healthcare professionals, both now, of course, and in the future. We also know that a well-functioning health system has the resources when and also where they're needed most. So why is it so important that we focus on the health workforce today? Well, I'll probably start off by saying what I say in most presentations, which is that you can't really open the news feed without seeing some sort of article on the struggles that we're having with the health workforce. We've heard of, especially during the pandemic, about ER closures that were happening. We know that nursing staff and other frontline workers are experiencing quite a large amount of burnout. We know that there's also staffing shortages at many facilities and quite a number of job vacancies, so unfilled positions within the healthcare sector. And at the end of the day, each of these issues can affect the overall quality and care of patients, just like you and I, who access the healthcare system, as well as the outcomes that we and others may experience because of these shortages, vacancies, and burnout. But in order to develop solutions and make evidence-informed decisions, we need accurate and reliable data. And this is where HIE plays such an important role. And we heard about this, of course, in some of the earlier conversations from my colleagues, the importance of standards and how HIE fits into that whole landscape. So I want to talk a little bit now about health workforce information at HIE. So at HIE, we have an actual branch, the Health Workforce Information branch, and we produce a lot of products and kind of initiate a bunch of work that goes on regarding the health workforce. We actually have essentially what are four databases that are housed within our branch, and that's the Health Workforce Database, or HMDB, Scott's Medical Database, the National Physician Database, and the Patient Level Physician Billing. So the Health Workforce Database is both a record level and aggregate level database. It contains information on more than 30 different groups of healthcare professionals, and record level for about 8 of those professions. In fact, I believe it's nurses, various types of nurses, pharmacists, occupational therapists, and physiotherapists are the ones that come to mind. The SMDB, or Scott's Medical Database, is also record level information, and it includes information on the number and distribution of physicians by specialty across Canada, and this also includes family physicians. The NPDB and the PLPB, the last two that you see on your screen right now, are kind of intertwined, if you will. The NPDB, excuse me, the patient level billing data feeds that information into the National Physician Database, and essentially contains information on the demographic characteristics, for example, of physicians, physician payments, and the physician's level of activity within Canada's healthcare system. So that's sort of at a high level what the branch collects. But I do also want to mention that we have a vast variety, or a vast number of other sources of data regarding the health workforce. And so there's quite a bit of information on this slide in terms of the bullets. What I'd ask, just for simplicity, is you focus on the top in the red circle here. And that's just to highlight that we get a lot of health workforce information data from clinics or hospitals, from financial data that's collected, as well as survey information, regulatory colleges, and drug and physician billing. And you might recall earlier in the presentation, Mary Chantel had mentioned that we have 28 different data holdings and a variety of different sources. So this sort of feeds into that. There's a number of different ways we collect health workforce information at HIE. But also worth mentioning on this slide is that all of this data can be linked by facility number, which is going into that interoperability that we were just talking about. And some of the databases are actually going to be linkable by patient or record level data. So we have all of this data, but what do we do with it? So the Health Workforce branch and HIE broadly create a number of different products. So the first products that I'll mention are data tables, and these contain information on the supply and distribution and demographic information on 30 plus 30 plus healthcare professions. And you can think of these as sort of like very detailed, raw, Excel-based data tables. Kind of alongside those data tables, we produce methodology notes, and those are available for these data tables, and they essentially summarize the basic concepts underlying the methodologies, strengths and limitations of these data tables. And then we get into something called the Quick Stats, which is one of my favorite products that we produce. It's an interactive tool. I'd call it somewhat of a dashboard of sorts. It is Excel-based, but it's meant to be interactive for the users. And it contains a variety of information that includes the supply, the number of people who are actually employed within their profession, inflows and outflows, migration of new graduates, for example, and we even have some new information on vacancy metrics, which I'll touch on a little bit later. Another interactive tool that we have is called the physician and nurses per one, well, it's not called this, but it's essentially physicians and nurses per 10,000 population by health region. And so what this is, it's an interactive map that you can find on our website, and it allows you to scroll in or zoom in on each of the different health regions in the country and by province to indicate, and it will indicate how many physicians or how many nurses are there per 10,000 population in that particular region. Then we, of course, have other more static products like infographics. There's one on a physician that indicates some details on physicians, And of course, we do sort of more of the cliche style reports that you might be used to in terms of PDFs, if you will. Typically, these are all electronically produced now. The most recent one we did was called Hospital Staffing and Harm Trends Report, and that was produced in 2023. We also do an annual digital report, which kind of outlines a broad or a variety of different findings from across the data holdings that we have. So we have all this data. These are the types of products that we produce, but who uses it and why is this valuable for anyone really? Well, FPTs and RHAs, so that stands for federal, provincial, and territorial users, and RHAs is regional health authorities. They can use this data to determine capacity needs, for example, evaluate patient safety of different care models. They can also use it to determine the number of education seats that are required, especially when we're looking at supply and demand metrics. We can also look at, or they can also look at and determine the number of international graduates that might be needed to bring into a certain region or province. We can move along to professional associations and regulatory bodies. These are one of our main users as well. They help to define scopes of practice with our data and credentialing. They can lobby for patient safety, and they also help to ensure the protection of the public through a competent workforce. Researchers like yourselves who are on the phone, academics, we support essentially this body of individuals, allowing them to access the data and conduct analyses and perhaps even conduct some predictive modeling. Labor and unions are another group that we use that can help monitor, supply, and lobby for membership rights. And then, of course, the public, so the general Canadian public, as well as media and other third parties often access our data, whether or not it's just for verification, if it's a media report, if they want to conduct their own analysis as well. So there's a variety of reasons why they may access our data or be interested in it. Sometimes it's just curiosity. And then, of course, other users of our data could be international organizations like the OECD, the WHO, or the PAHO. And oftentimes that's used for international reporting and comparisons and other types of analyses. So what I wanted to mention, what I thought would be important for this group in particular, is how to access this data. So as Mary Chantel mentioned at the beginning of the presentation, we have 28 different data holdings and many records. HIE does provide this information to anybody who's interested in receiving it. It is in fact on a cost recovery basis though, meaning that if you have a very complex analysis that you'd like us to complete, it's based on the number of hours that it would, the cost would be based on the number of hours that we'd have to put in. And if it's simple or relatively straightforward, like a data table, it's much less expensive. When it comes to accessing record level data, we've actually recently developed what's known as our SAE, or Secure Access Environment. And what this is it's essentially a cloud-based environment that users who are looking to access record level information can access remotely from their desktop. So they don't need to be supplied with the data. It doesn't need to be sent to them. Way back, aging ourselves here, way back we used to provide data actually on like floppy disks. We've moved a long way from there, and now people can actually just log in remotely to this environment that's very secure, and they can conduct their analysis right within there. But what was really important for me to mention here is that we have, I mentioned the cost recovery basis that we use here at HIE, but we have what's called the Graduate Student Data Access Program. And this I thought would be particularly relevant for this group because what it does is it allows students such as yourselves to access a number of our different data holdings for free. So we have a program in place that basically ensures that once you meet a certain number of criteria, we can provide certain data to students who are interested in using it. And so not all of our databases are eligible for this, but health services databases, health spending, and health human resources or health workforce information does qualify for this. So if you did have any other questions or interests about it, I would recommend just visiting the HIE website and entering GSDAP into our search bar, and that should bring you to the appropriate web page. Okay, now on to the exciting stuff. Let's talk about some of the new projects and initiatives that we have underway at HIE. So I want to start off by talking about our roadmap. And the roadmap is less an initiative and more of a guiding principle or a guiding map for us right now. Our roadmap is really a 5-year plan that outlines where we are and where we want to go. So we've essentially what we want to become is a world-leading data-driven pan-Canadian health workforce information system. So we want to be a global leader in this field. And to do that, we set out 4 goals. The first one is to develop a provider-centric health workforce data platform to facilitate analyses and meet stakeholder needs. The second one is to acquire additional data. So I'll talk about that in the next slide, but there's some gaps that we have right now. We don't have data on every single profession, at the record level. So we want to expand that. We want to ensure that we have new professions and new data. We also want to create user-friendly access to comprehensive data. And then we also want to enhance health workforce information analyses through a development of new methods and new tools. I mentioned just a minute ago that we are looking to close some data gaps. And this slide is really just meant to represent some of the gaps that we can attempt to close right now. So we're looking to update and renew some of our data standards. And you all just learned about what data standards are and why they're so important. We'd like to, again, as I alluded to earlier, expand some of our professional coverage. So one of the things we're looking at right now is how do we get more information on unregulated professions in Canada? And we're also in the midst of starting to collect and pilot personal support worker, or PSW, data. Looking at new sources of information. So for example, payroll, or scopes of practice, or other education-based data platforms. And looking at new methods and tools. For example, developing new linkage methodologies, full-time equivalent methodologies, so calculating those, and developing new planning tools. The last thing we were also looking to focus on is integrating health workforce information data into more of the interoperability that we were just talking about. We can use this data, for example, to analyze the impact of models of care on resident outcomes. So an example of this might be, for example, looking at the number of nurses or personal support workers in a given facility, and then looking at the outcomes of that facility. Is it doing better or worse with more or less FTEs? What credentials do these individuals have? So there's a lot of opportunity still with the health workforce information, and we're working slowly but strategically towards accomplishing these, closing these gaps. The health workforce information standard is kind of the first part of our map that we're trying to accomplish. So this initiative is about the health workforce database that I mentioned earlier. You heard about standards earlier. And just as a reminder, so this standard is meant to document and outline how information should be captured by the regulatory bodies that are submitting to us. So from 2006 to about 2019, we developed some standards for specific occupations to submit data to HIE. But those were very occupation or profession specific. And this causes problems. Obviously, one of the things that we were talking about in the earlier conversation was around consistency, comparability, these sorts of things. So when we have 6 separate professions, for example, or standards, it becomes very complicated and kind of unusable to a degree. So what we set out to do was actually develop a revised version of our health workforce database standard. And this was intended to actually be sort of profession agnostic, essentially meaning that it doesn't matter what profession or occupation we're looking to capture information on, you can use this one standard. It's organized by categories. So this new standard is organized by categories like demographics, education, and employment. And it also enables implementation across variable data sources. One of the benefits of implementing this new standard is that we've added some new data elements. And some of the ones that I've been fortunate enough to be working on and have worked on the past year or so has been the primary site organization identifier, which allows us to understand what facility or what hospital these individuals are working at, and if there are more than one facility that these professionals are employed by or with. And the other one is a national unique identifier, which is really intended to allow us to better link data as we move forward with expansion of our data sets. This slide is really just meant to give you a quick overview, a snapshot of the information that we capture. These are the core data elements that we're capturing now in this, what I'll call a universal standard. So we have information on registration, so the type of provider that they are, their unique identification number, their provider registration province, so where are they actually located, demographic information, so gender, sex at birth, birth year, language, racialized group, Indigenous identity, geography, so where are they currently residing versus where do they work, education information, so what's their basic level of education, what year did they graduate, what are their credentials essentially, and then employment information as well, and we have a variety of variables there. One thing I will note too, and it's footnoted at the bottom of this slide, is that we are going to be removing sex at birth from the next planned update of the standard, which happens every 3 years. And that's just based on stakeholder feedback and some legislation, I believe in particular in BC, that limits the type of information that be collected. So we currently do collect it, but it will be removed in the next iteration of the tool. This is just going to be a quick high-level demo of what this looks like. So it's one thing for me to talk to you and tell you what it is. It's another thing to actually see sort of more hands-on what it looks like. So when you go to our website, you'll actually come across a document like this. It's called the Health Human Resources Minimum Dataset Data Dictionary 2022. This is the cover page. It's got your basic table of contents. So it'll show all the different fields, a little bit of background about the document itself. So what's the purpose? Who is this document? What was this document intended to do? And who is it for? So the audience. And then kind of I gave a couple of screenshots here of what the content of that document looks like. So I've included a couple of different data elements, provider concurrent registration, their gender and primary site organization identifier. And you'll recall, I believe it was Christine who was talking, or maybe Jacqueline was talking about value sets. So this you'll see here, you have a value code, let's say for gender, the value label and the definition. So it really sets out exactly what the providers need to complete when submitting their data to HIE in order for it to be considered acceptable for use in any of our reports or data tables that we produce. And then this slide here is really what I wanted to do was show you sort of an ideal state of how we'd like the standard to be implemented and the data to flow to HIE. So currently, I might back up a slide here. Currently, healthcare professionals that are registered, so regulated healthcare professionals have to complete an annual registration form. And this is captured by the regulatory body or the professional association and ministry, and then submitted to HIE. And we try to make sure that it maps on to our standard or existing standards, clean it, and then kind of produce it and make sure that there's no sort of errors and that it's acceptable for use. When we have data standards, and this was touched on already a number of times, when we have standards, it makes it a lot easier for everyone to capture this information and utilize it. So in an ideal state, we'd have all regulated health professionals having implemented the minimum data set standard, then submitting it to HIE already formatted, already using the value sets and codes that we have and the definitions that are appropriate, so that when it comes to us, we can immediately just utilize it in our tables and any of our reports. This isn't the case for all professions right now, of course. We're in the midst of implementing this new standard, but we do have a number of health professions that have accepted and have adopted or in the midst of adopting this new standard. So I just wanted to give a quick overview of some of the questions, or example rather, of some of the questions that can be answered with this information. So if we're looking at questions around diversity and inequality, we might ask a question like, does Canada's health workforce have the capacity to support diverse population needs? Or what inequalities exist in the healthcare system? And to the left of all these questions, you'll see a list of variables or data elements that we can use to answer some of these questions based on the standard that we've just implemented. So questions about models of care and outcomes, access to care, migration, recruitment, and retention. These are all questions, or the questions that you see here can all be answered using the data elements from the standard that I just spoke about. The next initiative that I want to talk about is one that's actually quite new and quite popular among our stakeholders. It's known as the intervention scan. And what it is a tool that is intended to capture any and all health workforce interventions that have been implemented in Canada. And so what do I mean by a health workforce intervention? Well, that could be something like a change in practice. It could be the opening or resuming of services. It could be recruitment initiatives or retention initiatives. And so how do we go about doing that? Well, we scan government news releases, for example, and other sort of gray literature to find out what's happening. This is done on a quarterly basis. And so every quarter or throughout a quarter, we are scanning constantly government news releases, other publications, any sort of gray literature to find out, have there been any new interventions implemented relating to the health workforce? And once we have that information, it's put into this tool that has somewhat of an interactive component to it. And it allows you to they have an option to filter by the intervention type, profession, and sector. And I want to, hopefully this will work. I want to switch screens here just to see if I can pull up the intervention scan. And Linda, maybe if you could let me know if you see an Excel document now on my screen.
Yes, we can,
Okay,
thanks.
perfect. I'm glad it's working. So the intervention scan, this is what it looks like. It's an Excel-based document. It's got about 7 different tabs. So just an overview of what the document looks like, or excuse me, is intended to do. So notes for the readers, a table of contents, mentions of terminology, essentially a glossary, a timeline, and then a summary dashboard along with the data, sort of like a raw data tab. And so this is really the tool at its best visual, it's sort of the best way to look at the data is through this sort of summary dashboard here. What you can see is that we have information on the count by intervention type, starting at the top left corner. Moving across, we have the number of interventions by nursing type and the type of intervention. So for nurses, how many change in practice interventions happened in Q4 of 2022, 23. There was 1 for nurse practitioners and none for any of the other types of nurses. In the top right corner, we have a breakdown of the same types of interventions by jurisdiction or province or territory. Scrolling down, we have counts by the province and territory, just more aggregately. And then we have it by profession along the bottom right here. You can see midwives, nurses, paramedics, etc., and the number of interventions that were implemented during that time period, or whichever quarter that we're looking at. If anybody, so when you're looking at this document, you also have the option to look more closely at the details regarding that intervention. So this document will actually contain so who conducted this intervention, who implemented it. In this case, it was the government of Canada, and they signed a $1 billion bilateral agreement to Alberta to improve healthcare. And then there's a link to the actual article itself. So this is a very useful tool when looking at the metrics that we collect in terms of supply, distribution, retention, recruitment, education. You can see what sort of interventions have been implemented to see, are we seeing changes in the numbers, and what might, it helps to contextualize the information that we're collecting at the more kind of raw number level. So let me just jump back to the slide. And this is just meant to give you an idea of the types of questions or the way we can summarize this information. So around recruitment, we know that there's essentially 169 recruitment interventions that happened in the past year. Retention, there were 74 different interventions that were implemented. Changes in practice and access to services. So we've given examples. I think you may have copies of the slide deck. You can take a little bit of a closer look at this, but just in the interest of time, I'm not going to spend too much more time on this slide. So the next product I want to talk to you about is the data catalog. And this is our newest product. It's actually still sort of in a testing beta phase, if you will. But really what it is a database that allows you to identify where any health workforce information is located within HIE or Statistics Canada. So I figured one of the biggest issues that's often faced by researchers, students, analysts, and decision makers broadly is, where can I find the data that I'm looking for? It's often somewhat time consuming, and this is really meant to solve that problem. So HIE has actually collaborated with Statistics Canada to create this HHR, Health Workforce Information, or Health Human Resource Data Asset Catalog. And that's meant to really increase awareness of the data that's available, but also make it a lot easier to find the data that you might be looking for. So this tool provides information on where health workforce information data sits, both at HIE and Statistics Canada. It includes a description of the data holdings and what health workforce information and data is available for which professions. It also contains direct links to relevant resources such as minimum data sets and manuals, data dictionaries, and methodology notes if that's needed for the analysis or for interest. I'm also going to try to show you a beta version of that as well. Hopefully the Excel is showing up again. Again, it's currently Excel-based, but this is meant to be an interactive online tool that's going to be hosted on a partner organization's Health Workforce Canada's website. And so just very, very quickly here, you can see this is what it's currently looking like. So here's an example of one of the databases that HIE describes the database, and it provides information on the type of occupations that are captured in that database. It's organized by themes, so in this case, labor, and sub-themes, and it indicates kind of the level of information, how it's collected, and when it's refreshed. So this is a very, very valuable tool that's going to be released quite shortly, and it includes not only HIE data, but also Statistics Canada data. So again, look, in the interest of time, I'm just going to move on. And that's not released yet, so it's sort of, as I mentioned, still in sort of testing phase. The last project I want to talk to you guys about is the Quick Stats. You may have heard me allude to this earlier in the presentation. I said this was one of my favorite products that we produce. It's interactive. It's really like a dashboard for us. And what it is, it's an interactive tool that's meant to provide a lot of detailed information around the supply, distribution, inflows and outflows of the health workforce, including some graduate migration and new vacancy data. It includes hospital staffing indicators, including hours worked, overtime, sick time, and the number of purchased hours. I'm hoping to give also a quick demo, so I'll try to pull this up on my screen. It's sort of a very large data set that's included in Excel. So if you do download it from our website or you do get access to it, it may take a couple minutes to actually download because it's quite numerically heavy. So it provides an overview, as I said, of what the tool looks like, information on the supply of the workforce. So in this case, we're looking at the registered nurses in each of the provinces. You can actually select the type of provider you're looking for here in the top. So it's all drop-down menus. So we could select, for example, occupational therapists who are located in Manitoba, and we can have two different comparators. And it will provide sort of a summary of the data and information we have, in this case, on the supply of occupational therapists in Canada. I'll just scroll to the end because there's a lot of information in this particular tool, but I wanted to make sure you had a sort of a visual when I talk about these things. The latest addition to this tool is the vacancy metrics. So this is calculating the average number of job vacancies or unfilled positions within Canada by a specific occupation. So in this case, you can see here that professional occupations in nursing, so registered nurses or registered psychiatric nurses in Ontario, as of 2022, there were 9,940 vacancies. And this is based on information from Statistics Canada's job vacancy and wage survey. And the vacancy metrics I just mentioned. So I just wanted to highlight this very quickly. We're currently we have a number of databases and a lot of data on the supply side of the health workforce, but what's a little bit trickier to obtain is information on the demand side. And so what we set out to do last year was try to obtain job vacancy information. So we partnered with Statistics Canada, and we used the job vacancy and wage survey I just mentioned, specifically looking at 8 occupational groupings that mapped onto that Quick Stats tool that I just mentioned. We looked at data from 2015 to 2022, and ultimately what we find, and these are findings I'm going to be presenting at the upcoming Casper conference next week, is that job vacancies have actually more than doubled since 2009, from around 55,000 to just over 120,000 for all health workforce groupings that we were looking at. And in particular, interest to you might be that personal support workers, nurses, and select mental health workers accounted for 2/3 of all health workforce vacancies in 2022-23. And I forgot I have an animation on the slide, but this was just meant to show you that quite a large increase, even looking at 2015 from around 30,000 job vacancies, skyrocketing up to 120,000 job vacancies in 2022. And then, as I just mentioned, the groupings, the occupational groupings that accounted for the most job vacancies were personal support workers, followed by registered nurses and RPNs, followed by select mental health occupations. So those were a kind of a high-level snapshot of some of the projects and initiatives we have underway at HIE currently. So I just really, the purpose of this presentation was just to bring attention to the health workforce itself, give you a sense of when we use that terminology, who are we actually talking about? So basically frontline workers, but a little bit more broadly even. And some of the products that we have, some of the data that we collect, an understanding of who uses that information, and then of course kind of a bit of a product demonstration of these tools that are available to you all on our website. And you can do that by visiting kaihi.ca/health workforce. So I believe that's the end of my presentation there. So I'll pause and hand it back over to you, Linda.